A bite from a venomous snake can be deadly and should always be treated as a medical emergency. Even a bite from a harmless snake can be serious, leading to an allergic reaction or an infection. Venomous snake bites can produce an array of symptoms, including localized pain, swelling, convulsions, nausea and even paralysis. There are first aid steps you can take after a snake bite occurs. However, it is essential to get the bite victim to a medical facility immediately for emergency treatment. If treated in time, the outlook for recovery is good. First thing to do when you see someone has bitten with snake is to get the patient away from the site. Move to a place where the snake is not likely to return. Try to remain as still as possible once you have reached a safer area. Movement can cause the venom to move more quickly through the body. But better you identify the type of snake, that whether it is poisonous or not, because identification is important in planning treatment. Also the place where incident happen. Cobra are mostly found in forest, viper in field and kite in home surrounding. Keep the person calm. Acute stress reaction increases blood flow and endangers the person. Expose the area and immobilize the limb. Keeping the bitten part of you below the level of your heart slows down the flow of any affected blood towards the heart. Remove constricting clothing or jewelry such as ring and watch. The area of the bite will likely swell, so it is important to remove these items quickly. Allow the wounded area to bleed for at least 1 to 2 minutes. Wash it with clean water and soap for several minutes. Rinse the wound thoroughly with more water, then wash it again. Pat it dry with a sterile piece of gauze. Use an alcohol-soaked pad as disinfectant if it is available. Put the splint 2 to 4 inches above the wound in order to immobilize the limb. Keep the splint loose enough to let the circulation flow through the bitten limb. Here are some advice which you should not do at the time of treatment. First thing is that you should not apply ice pack over the wound. This reduces circulation, concentrating the venom in those tissues and may make tissue damage more likely. Do not incise the wound because it often increases the chance of infection. Do not try to suck the venom out using your mouth or the extractor. It is dangerous because you could absorb the venom through the membranes of your mouth. And, in the process, you will transfer bacteria from your mouth into the wound, increasing the chances of infection. Do not apply a tourniquet. Reducing the circulation will concentrate the venom in that limb, making tissue damage due to the venom more likely, and cutting off the circulation entirely could permanently damage the limb. The most important thing to do for a snake bite victim is to get him or her emergency medical help as soon as possible. A doctor will evaluate the victim to decide on a specific course of treatment. In some cases, a bite from a venomous snake is not life-threatening. The severity depends on the location of the bite and the age and health of the victim. If the bite is not serious, the doctor may simply clean the wound and give the victim a tetanus vaccine. If the situation is life-threatening, the doctor may administer an anti-venom. This is a substance that is created with snake venom to counter the snake bite symptoms. It is injected into the victim intravenously. The sooner the anti-venom is used, the more effective it will be. But be careful, it should not be given at the field site. Because it can cause the anaphylactic reaction, that is life-threatening allergic reaction. So should be used cautiously. Later on, after the discharge from hospital, take care of the wound. Frequently clean the wound and put antibiotic over it. Please like, comment, share and subscribe the video. For more information, visit my website, www.jyotsnapande.com.np. Details are given below. Thank you for watching.